Welcome back to Behind the Scrubs. I'm Dr. Rudolph Eberwein, and I'm a member of the Friends of Medicine Foundation. And I'm here today with my colleague, my friend, my patient, Dr. Jaime Sepulveda, and we're going to be talking about everything men's health. I want to thank everybody for tuning in and for the support. And I also want to thank our sponsor, A New You Physicians Wellness, which is actually my weight loss clinic in Pinecrest, Florida. Please remember that the information in this podcast is for educational purposes only. And if you have any specific health concerns, please make sure to consult with your own physician. So, Jaime, welcome. I'm so glad you're here. It's interesting. Dr. Sepulveda is a gynecologist, and he's here talking about men's health because November is Men's Health Awareness Month. So, Jaime, how come you're talking about men's health?
Well, as a gynecologist, you learn that women have been taking much better care of themselves than men.
Completely.
So I've learned from my patients through my practice. I've been in practice for 32 years. Through my practice, that the women keep their families healthy.
Yeah.
And part of that, many times I get asked, what can I do for my husband? My husband has this. And that's how I got involved in men's health.
Amazing to see a gynecologist, you no longer do OB, as you said, and don't get it twisted. Dr. Sepulveda here is a pillar in our community. 32 years of experience, and he is just adored by his patients. Not only is he an amazing surgeon, he's just an amazing man. And what I want to talk to Dr. Sepulveda today is really the transformation that he's had and how he was able to almost find joy, find bliss, find passion again in his life. And we're going to talk about the tools that helped him get there. So tell me a little bit about your story.
Like most physicians, I work hard and I enjoy working hard. You enjoy taking care of patients. You enjoy the surgical aspect. I haven't done a delivery in almost 25 years, but the gynecology part and my subspecialty of urogynecology allows for you to transform people's lives. That requires to be at your top game. You're taking care of people, you're taking care of your surgery. They trust you to take good care of themselves. So you need to be at your top. And inevitably, age, bad habits, bad eating habits, exercise, bad exercise habits. Just because you exercise doesn't mean that you have a great habit on exercise. That eventually gets to you, and that may interfere or makes it harder for you to enjoy yourself doing what you love.
Yeah. And it's interesting, right? Because we're seeing such an accomplished person who at some point in his life felt like he knew what he had to do, but he was having difficulty really getting to the best version of himself. And that's when we met, right? We had common friends, common patients, and we had a long conversation about, again, when he came to see me, it's not that you were overweight, that you were obese by any means, but you were like, I need a little push. I need a little help.
And I was still enjoying doing everything. I still enjoy my family, my community, my patients. I enjoy all that, and I was very successful at that. It's just how to be kinder to yourself, how to make it easier. How am I going to make it easier for myself and to be able to continue developing new things that will help the community?
Completely. Because again, as we age, again, my specialty is age management medicine, anti-aging medicine, optimization medicine, whatever you want to call it. But as you age, things don't come as easy as they used to. And we all suffer from this. I'm 54 now. What used to come easier to me before is not. So, but I don't want my performance in any area of my life to go down. So what can you do to help maintain, even increase your performance as you age? And when I say performance, whether it be performance at work, at home, in the bedroom, at the gym, anywhere, as a member of society, I wanted to stay young. I want my patients to stay young, vital, and fit. So when Jaime came to see me, we had a really good and honest conversation. Jaime was a 7 or 8 out of 10. Right? When I see some of my patients, they were 2 out of 3. You were still doing really well, but you knew you could be a 9. You could be a 9.5. And you needed those tools. So I want you to talk about what you think helped you get that extra to get you to where you are today. As you said, the renaissance, man.
First thing is that self-awareness that my brain is in one shape, my body's in another shape. Yes, I look well. I'm not excessively overweight. But there's a disparity between what your brain is telling you and what your body is, how your body is performing. So that's where you come in and say, okay, I need, in addition to my conventional medicine, I want a good evidence-based protocol that will help me be better, will keep me healthier, will reduce my risk of cardiovascular disease, will reduce my risk of inflammation. All those things together, that's what brought me to you. And I say, okay, we need to work on this.
Amazing. And just to let you know, Dr. Jaime gave me the authorization to talk about his health. So no HIPAA violation.
No,
right?
no.
So what we did when Jaime came to see me, we did an extensive lab test and we looked at inflammatory markers, hormone markers that usually you would not do at your regular yearly physical exam. And then what we discovered, like most guys as we age, testosterone levels were not optimized. You had a little more visceral fat, what I like to call the visceral adipose tissue, VAT. You didn't have a lot of weight to lose, but you had inflammation. I call it, not just me, inflammaging. So you needed something, and what we've always talked about, because you're a physician, you're a scientist, you help transform patients' lives, you know what you should be doing. Tell me about how the treatment that we put you on. So we did hormone replacement with testosterone replacement therapy, and we've used also GLP-1 medication, in your case, tirzepatide. And I like that combination of testosterone and tirzepatide. I call it the T-square combo, the T-square stack, because it can really address the metabolic dysfunction that really prevents people from getting into the best version of themselves. So tell me a little bit of how you reacted to that therapy.
So initially, I defined my journey in 3 different stages. And I want to put that right there. Number 1 is you go through the first stage, which is the detoxifying phase. And the same way that I speak to my patients about hormone replacement therapy, that's the way I approach it. The second stage is re-educating yourself, relearning different things such as eating, the way you think, the way you process your thought, your information. And then there's, at the end, the freedom phase.
Yeah.
And that's the one that you really enjoy. So the first one is, what am I doing every time I make decisions about eating, every time I make decisions about reading, non-medical, we got the medical part down, we got the surgery down, but reading about different things. What am I doing when I'm watching the news for 3 hours? And by the way, they're telling me exactly the same thing that they told me in the first 15 minutes. So when you start looking at those things, then you have to detoxify. You need to learn better decisions. What you need at that point, what you definitely need at that point, is optimize your metabolism. You cannot empower yourself to go into the next stage unless you optimize your metabolism, which is what the tirzepatide and the testosterone does.
And it's really important because when we talk about metabolism, people, even doctors, will think that we're just thinking my metabolism is slow, I can't lose weight. Metabolism is not just how you process food. Metabolism is the overall functioning of the human body, which can be altered by age, by our toxic environment, and by so many different things. So right now, we are in a metabolic dysfunction crisis. Metabolic disease is what's killing us. 2 out of 3 Americans now are either overweight or obese. More than 30% of the population has insulin resistance. The rates of cancer, of cardiovascular disease, everything is increasing. So we ask ourselves, what are we doing wrong? And it is, as you're saying, our habits. We consume the wrong types of foods. Unfortunately, our food source is toxic. The wrong kind of news. We live in a toxic soup around us, and we see the results of metabolic dysfunction. What you're able to do, and I love the way you put those 3 stages, the detoxification, the relearning, and then the freedom phase. And now I can say, my friend, you are in the freedom phase.
Absolutely. And we should never normalize. I tell my patients every day, you should never normalize or settle for anything less than that. You should never, the lack of freedom should never be normalized.
Yes.
We need to have that self-awareness and being able to understand that you can actually do it.
Yeah.
That this is not just anymore about, oh, you need to exercise, you need to eat better.
Yeah.
No. We are beyond that stage. We are much more advanced in medicine. And the future of medicine is understanding each individual with what you can modify, what you can change, what you can improve.
Completely. And one thing I want us to clarify, testosterone replacement therapy, which I am on testosterone therapy also. So I did not learn that in medical school. I had to get an extra board certification to really understand that we live in a different world of endocrine disruptors where our endocrine system is being attacked by so many places. And we're seeing more men and younger men with low testosterone, hypogonadism. And when I went to medical school in 1991, they told me testosterone was dangerous for you. Testosterone will give you prostate cancer. Testosterone treatment will give you a heart attack. And now all the studies are showing the opposite. And what we're doing, and we're seeing that in the world, that with the proper knowledge, the proper support, and on the right patient and the right follow-up, testosterone replacement therapy can be life-changing. So tell me a little bit, especially you being a gynecologist who prescribes testosterone for hormone replacement therapy for women, how was it for you as a man to see, like, I need also some hormone replacement?
Well, the first thing that came up is a candid conversation with my patients. After a few years, you sometimes come to realize that many times you're looking at a mirror when you're talking to a patient.
Jaime.
You're giving all this counseling, but unless I show, I show this is the way I do it, my patients would not get it. That's an actual combination. That human touch, that you know that patient, you have that empathy to understand. I know it's really hard for you, and let me share my personal journey on it. This is, when you say personal journey, I don't want to do a hyperbole on it. This is just about getting better.
Completely.
And the same way that we got patients better on hormone replacement therapy, now men have that advantage. We can improve ourselves, our relationships, enjoy our profession more, take care of more people, and enjoy our families. And of all things, continue to be kinder to the most important person in the world, yourself.
Beautiful, beautifully said. And the issue really, and I see so many patients in my practice, so many men who are finding, they know in their mind all those things they should do to be better. But lack of energy, decreased motivation, depression, anxiety, just feeling blah. Those are all symptoms of low testosterone. People have the misconception that testosterone is only for big muscles and for sex. It helps with this, but it's so much more. And you're looking at such an accomplished man like this, who at some point had to have an honest conversation with himself to be like, how can I be better? What is holding me back? And we discovered, and your testosterone wasn't low, quote unquote, below the low numbers. But we don't settle for average. We settle for top of the class. We've always been like this, and we'll continue. So what we've done with Jaime is we're like, okay, your testosterone was at the lower levels. He exhibited symptoms of hypogonadism, low testosterone. We had a discussion, and we decided to start testosterone therapy and look at the results. Right?
And I mean, in a very concrete way, that's just one part, one building block. The tirzepatide comes into play too, because that's the way you modify metabolism. What is this metabolism modification? Is, okay, I used to eat all this. I used to crave all these different things. This ice cream at 11 o'clock was delicious. It's not delicious anymore. When I go to eat, I don't have to order my whole bread, appetizer, main course, dessert. I don't have to order all that. I can try different things, and that's how you start detoxifying. Now, a good question is, many patients ask me, how long does that take you? Because you know that you start on tirzepatide and you think that you're going to start losing weight. No, that's your metabolism is telling you, I want to change. I really want to. You're putting these things on me, but I want to stay where I was before. I said, no, you're not going to stay there. I'm the one that decides how you go. Yeah. And that's where you start making better choices. Food, of course. Food is great. Culturally, we relate with food. Yeah. We celebrate with food. We even cry with food. We mourn with food. And in addition to that is just the new projects. Have I left something that I wanted to do a while ago? Okay, that battery from my motorcycle, I know it needs to be changed. When I'm going to get to do that? And those are the things that you start working on. And that conversation with your family, that conversation with your friends, enjoying the friendship. Yeah. Taking the time one day and say to your friend, hey, are you free for lunch? Let's go and have. Women do this. Yes. Men don't do this.
We don't do this.
We don't call each other. What's wrong with you? Why are you coming to have lunch? I want to have lunch. What, do you have any business or anything? Yeah. No, I want to talk about ourselves. Oh. I have walked into this office to see you with one of my friends.
I remember that.
That's how you take care of friends.
Friends, yeah.
That's really at the freedom stage, but in the detoxifying phase, and that's going back to how long it's going to take you, I think a reasonable time is 6 to 8 weeks.
6 to 8 weeks.
It's not far.
Yeah.
It's 6 to 8 weeks that you're going to do it.
Hi,
I'm Dr. Rudy Eberwein. I'm the founder and CEO of a New You Physicians Weight Loss Program, and we are delighted to be the sponsor for Men's Health Awareness Month, series of episodes for Friends of Medicine, Behind the Scrubs podcast. A New You is a functional medicine, health, wellness, and longevity clinic that I've had with my wife, Keisha, for the past 15 years. We focus a lot on helping patients lose weight, adopt better habits, hormone replacement, and overall wellness. I am an expert at using GLP-1 medications, testosterone replacement for both men and women, nutrition, behavior modification, and at the end of the day, I really try to help you be the best version of yourself. We also have a med spa associated with the clinic. We use cutting-edge technology with the company called BTL that has amazing services like the M-Sculpt Neo to help decrease belly fat and increase core muscle. We have IPL lasers. We have the M-Face to help with non-surgical facelift. So I'm excited to be part of the group, and I will have an open house very soon to invite every member to come and check out my clinic. Thank you. You can reach my clinic at 305-670-2131. We are on social media at drweightlossmiami.com. Our clinic name is A New You Physicians Wellness Program. Our website is www.drweightlossmiami.com.
Yeah. So I want to go back for our viewers to talk about tirzepatide. So tirzepatide is one of the new GLP-1 medication, glucagon-like peptide-1 medications, which I think everybody has either heard about them or knows somebody who's taken them. Those medications are a true revolution on our metabolic crisis. And, you know, people have heard about this, and there's a lot of negative comments about the medication. When used properly, it can truly transform somebody's life. And you're looking at, again, a man who has been able to be at the top of his profession with a mind, with a willpower that was second to none. But he felt like at some point you were missing a little bit of the control to make you change some of those habits. GLP-1 helped him do this. I always say that. I've been using GLP-1 medications on my patients since 2005, at first for diabetes, and since 2018 when semaglutide Ozempic came out. I consider GLP-1 medication not just a weight loss medication. They don't just in your stomach. There's receptors of it in your brain. So what it can do to your relationship to food, to bad habits, to drinking, to a lot of this, it's truly liberating. And the major side effect of GLP-1 medication is that you can have muscle loss with it, because as you're losing weight, you can lose muscle. And muscle is the currency of longevity, most important thing. When we do the combination of GLP-1 plus testosterone, if you meet the criteria, you can actually lose weight, change behavior, and at the same time, have amazing amounts of energy and build muscle.
And tirzepatide, when you look at the whole impact on the patient's health, yeah, I understand that that may not be a long-term. And this is not about, oh, I want to lose 20 pounds. I want to lose 30 pounds. Mm-hmm. The first effect is on your biggest organ, on your skin. The moment that you detoxify, you see your skin.
Less inflamed.
That glow, you know, the moment you get that glow, then you know that you're going to the relearning phase, which is the most interesting part. Because now things that you didn't think that you would like before, you start tasting it, you enjoy it. I can actually eat this, and this is healthy, and it gives a different flavor to that relationship with food.
Yeah, so they call it the food noise. That GLP-1 medication decrease the chatter in your mind when you have almost micro addictions to food, because we know that we should. A lot of those behaviors, we know we should stop it. But if somebody's struggling with controlling some of their behaviors, what I tell my patients, first, of course, you try to do it on your own. But if you're struggling, there's help. And what's amazing with GLP-1 medication, I'm going to just throw it out there, all the benefits that now studies are showing. GLP-1 medications have been found to be good for your heart. It's actually FDA approved to decrease heart disease. It's been found to decrease fatty liver, improve kidney function in patients who have kidney disease, improve sleep apnea, even decrease the risk of neurodegenerative disease like Alzheimer's disease, Parkinson's disease. They've even seen that patients taking GLP-1 medications have a decreased risk of cancer. 10 out of the 13 obesity-associated cancer, because you decrease inflammation, you decrease body fat. Body fat or visceral adipose tissue is an inflammatory organ. So by doing this, not only to me, the weight loss is so low on the list of priorities that GLP-1 can bring. It's good, we need this, but it's decreasing inflammation and changing your behavior, even more important.
Rudy, is the gentle way of treating a patient. How many times have we seen a patient that says, doctor, I'm so frustrated with this.
Yeah.
I cannot lose my weight.
Yeah.
And I'm gaining the weight right here. And you have that cortisol level kicking in. And then how do you look at someone like this and say, oh, you just need to exercise more and you need to limit your carbs?
Yep.
How unkind is that?
How unkind is this? Thank you for saying it.
You got to look at the patient in the eye and say, you need the right help. I don't prescribe tirzepatide. Yeah. I don't prescribe any of the
He sends me a lot of his patients.
So I tell him, well, you need the right help.
Yeah.
That's what's kind. Now, in terms of finance, there's no better investment than the investment of yourself.
In yourself. Yeah.
That's the best investment. That's what's going to be on your retirement account for sure. Yeah. The health that you get.
Completely. Health is the new wealth. And I want to go back onto something you said.
Health
is the new wealth. Invest in yourself. Yes. You said something so important, because we see our colleagues, right? Endocrinologists, urologists, talking about this. You said something important. I've seen patients here who are going to their primary care every year, gaining 5 to 10 pounds every year. Every time they go, what does the PCP tell them? Eat less and exercise.
That's it.
The patient says, but doc, I'm trying. They're like, well, you must be a closet eater. So they make the patient feel bad. We call that medical gaslighting, when you're trying to make the patient believe something that they know in their heart is not true. So what happens to that patient who is stuck with bad habits, cannot lose weight, have low energy, low motivation, and you keep telling them, all you need to do is eat less and exercise. It's such an empowered feeling when you give the patient the right tools to be able to go from point A to point B. And then now what's important, again, we're still evidence-based medicine. I still practice evidence-based medicine. Everything that we use has been shown to decrease inflammation, to actually be good for you when done the right way. Because I don't just prescribe those medications. I go over behavior modification, nutrition, exercise, making sure you exercise. Somebody like Jaime did not need even this advice from me. He knew. But this treatment was able to get him to do the things he knew he should do.
How can you tell a patient, male or female, you need to exercise when they have 25s on top? Try to exercise with a backpack with 25 pounds. Let's see how you feel with that one.
Exactly.
So this is the kind way of addressing this. And the way to do it is evidence-based. We have evidence, but not only that, we have evidence in the best journals, New England Journal of Medicine. So we have good evidence. It's just a matter of breaking our biases as physicians to serve our patients better.
Completely.
And especially what we're blessed in this community is to have you, because you take care of males. We have many gynecologists, but you concentrate on males' health.
Yeah.
And women are easily go to for medical care. Men don't do that. Yeah. But now we know that we have a place where we can go. I have my regular doctor, which I like him a lot. I adore my regular doctor, and you're my wellness doctor.
All right. I'm loving this, man. This is amazing. Thank you for saying that. And just to let everybody know, my specialty is internal medicine. But I had to you said something really important, the confirmation bias, right? So especially doctors, we're guilty of this a lot. What we've learned, we kind of want to keep learning only what we learn. I had to unlearn a lot of things I learned in medical school. When they told me testosterone caused prostate cancer and was bad for you. I had to unlearn when they're saying GLP-1s are bad for you, and to really see them as powerful tools to help you change your habits for optimization of your metabolism. And then this is how you change people's lives, and this is how you help people live their best life.
The most toxic event in anyone's life is biases.
Biases.
But the good thing with biases is the moment that you recognize it, when you work on them, and it empowers you, it frees you, which is our last stage, freedom.
Freedom.
That's
baby.
Freedom to be kind to yourself, freedom to be kind to that person that caught you in the traffic light. That's okay, bro. Yeah. I love you.
Let it go.
Let it go.
Let it go.
You just let it go. You have a good time. You may have a reason why you did that. That kind of freedom. And being not just now you're not just going to be singing kumbaya but all by ourselves. Now you're assertive. Yes. You can evaluate opportunities, you can be better professionally, and you can see for the future that we empower ourselves with the care of our patients and with the care of our families.
Wow.
We manage fiscally, we're better because our mind is free from all the other stuff. And now we have
real estate, you have room.
I have room to
put
what
new
really
good
matters,
habits.
what really matters.
So I like to say, I like my little sayings. I call them my Dr. Rudyisms. When you feel your best, you can be your best.
Yes.
Now that you feel so much better, look at things. He went back and he's getting a master's in Italian. After everything you've accomplished, now you have room in your brain, you have room in your habits to be able to do this. So for everybody listening, I think this is an important conversation. November is Men's Health Awareness Month. As you said, men tend not to go to the doctor. Men only, if it ain't broken, don't fix it. No. The first thing, as Dr. Jaime said, do an honest self-inquiry. Ask yourself, am I living my best life? Are you satisfied with the life that you're living? Are there habits that I can change? Of course, try to change it yourself. Change your nutrition. Eat better. Go to the gym. Start lifting things. Start exercising. Fix your sleep. Fix your habits. But if you see that you can't get there, know that there is help. There is help that is backed by evidence-based medicine that can help you. And something important you talked about. For example, the GLP-1. It's not like you're going to be on this for the rest of your life.
No.
Right? You needed a push.
To tune in, and anytime that you got other frequencies, the good thing about detoxifying, re-educating, and freedom is that you can go back to that cycle anytime you want.
Yeah.
But the most important reason to take care of this is the manly thing to do.
Yes.
That's what defines a man. To be able to act on it is the manly thing to do.
To take care of yourself and be the best version of yourself. Jaime, what an amazing conversation. You truly are a Renaissance man, what I like to call a theta male.
Well, thank you for taking care of me. Thank you.
What an honor, right? And this is great. I hope everybody listening to this gains something out of this. Number one, look at yourself. Number two, get your numbers checked, and not just superficially. Know what your hormone levels are like. Know what your inflammation parameters are showing. Know what your weakness is, what bad habits you need to do, and find yourself a provider who can really listen to you, understand you, and can provide you with the right tools so we can really live our life like this man right here. Thank you so much.
Thank you so much, man. Thank you.
All right. Thank you, everybody. And please remember to follow, like, and share. This is with Friends of Medicine Foundation. We're going to have the link for the Instagram and all the social media. Also, my clinic, A New You Wellness. I'll put all the links, and looking forward to talking to you again.